that's a perfect transition. How about
Hmm.
we go into the where is the pain right there? You're
Hmm.
already kind of talking to people about the masseter, maybe
Hmm.
just kind of educate people a
Hmm.
bit about where some of these main
Hmm.
muscle bellies are and
Hmm.
where we expect to see some pain.
Yeah, so they have the masseter, which runs all the way from the jaw all the way up, and where it kind of attaches up into the zygomatic arch
Mm-hmm.
there.
So kind of
And
this distribution for people
hmm,
watching on the podcast.
yep,
Yep.
yeah, it's kind of that distribution, and it can be a very sensitive area around there. So the keys there are going very, you want to kind of stick right onto it, and you want to go really slowly and kind of, and yeah, do kind of that very slow dragging technique. And then if it's kind of been gummed up there for a while, no pun intended, then you can then definitely some friction, and that muscle belly would not be remiss at all either.
Yeah.
And that.
I
Mhm.
was going to ask, do you find yourself going up into temporalis muscle as well too? Because I think those are kind of the
Mhm.
two major jaw clenching
Mhm.
muscles that we have access to from an external
Mhm.
standpoint, correct?
Yeah, yeah, I mean those as well. When you're really, um, when you're really focusing in on that area. But I you know I don't treat that area just in isolation.
Mm-hmm.
I also would also treat, um, the neck muscles, like kind of like in the back of the head, as well, kind of because how all of that is connected,
Correct. Yeah.
as well. So it's yeah, so a lot of, you know kind of stretching out the neck laterally, and yeah, just a lot of, there's a lot of, like surrounding work you do, as well as addressing the muscles that are kind of right around that joint there. Um, so with the, yeah, and then the other interesting thing is that the masseter is actually I think it's the strongest muscle in the body.
Like
So the.
pound for pound.
Hmm,
Yeah.
yeah,
Yeah. Yeah.
yeah.
I
Hmm.
think it's like a reference of.
Hmm.
Did you ever see that movie Shawshank Redemption? Maybe
Hmm.
long time ago, but I know
Hmm.
that was like one of the threats that the main character made about like basically the biting power of the jaw and why a guy
Mm,
didn't want to do a specific thing.
mm,
But that goes back to what you just alluded, pound for pound, the power that that could generate. It's
hmm,
incredible. So
hmm,
therefore, not a
hmm.
surprise that there's going to
Yeah.
be pain in there. Sometimes
Hmm.
people will feel, as far as this, to add on to some of the other things you said, yeah, pain in the muscle bellies, but they can sometimes point right to the joint
Hmm.
and they'll kind of, feel like that tenderness right in there as well too. And certainly
Hmm.
with that tight association with the jaw and the
Hmm.
upper cervicals, it's you pretty much have to bet that if
Hmm.
somebody's coming in and they're saying their chief complaints the jaw, like just like you, we have to go into the suboccipital muscles.
Hmm.
We have to go up into the upper cervicals because that pain in there can also just radiate back to the neck, but
Hmm.
even just the muscle behavioral pattern, they're going to work together. So we just kind of have to work on all of that.